Hello, my name is Cynthia Crumey. I'm here in front of the Winchester Hospital. Founded in 1912 by the Winchester Visiting Nurse Association and viewed at the time as a cottage hospital experiment, Winchester Hospital has grown from a 12-bed facility in a rambling Victorian house on Washington Street to the present 223-bed facility here on Highland Avenue. During the initial 2-year experiment in 1912 to see if the area could and would support a hospital, patients came in great numbers from Winchester and surrounding communities, and it readily became apparent that a larger hospital could depend for patronage on a wider territory than Winchester alone. The hospital has undergone 7 major expansions, beginning in 1916 with the original new building and culminating in 1984 with the major capital construction and renovation effort which is underway and is due for completion in 1985. The result of these changes is a new look to a large portion of the hospital. What remains the same is a primary commitment to competent personal care. This commitment by a small group of visiting nurses with a vision of excellence and $7,000 in their treasury has grown into a fully staffed modern hospital. Let's go inside and take a look around. We're going to meet with Carl Olson, Winchester Hospital's education director. Carl, generally speaking, when a person first comes into the hospital, they go into central registration. And I've heard that at Winchester Hospital, they're brought into central registration by a volunteer.
That's very true. We rely on volunteers for a great many things around Winchester Hospital. And bringing the patient to central registration is one of the things they do. The patient will come to this desk right here, and these volunteers will escort them over to central registration.
May we see central registration?
Oh, certainly. Perhaps you'd like to talk to Marcel Finn. She's the supervisor in central registration.
Sounds like a good idea.
Okay.
Marcel, what is the main service of central registration?
The main service of central registration is to process the patient, gather the necessary information, and to expedite their registration and get them on their way to wherever they have to go to.
How do the people in central registration treat the patient?
Well, I think they treat them super, but there are 2 words that I try to enforce here, and that is that when a patient comes in, they should change places with the patient. Those are the 2 words that will bring them closer to the patient and make them feel more at home.
Carl, central registration is one way that a person can come into the hospital, but what if there's an emergency?
Well, a real emergency would be admitted right through the ambulance entrance and be taken care of immediately in the emergency room. Following their treatment, then a member of the family would give information to central registration. Incidentally, I've arranged for you to talk with Mr. Smethurst, the head nurse in the emergency room.
Thank you.
Okay.
Bill, for many people, the emergency room is their first and perhaps their only contact with the hospital. What has the renovation meant in terms of the services available in the emergency room?
Just in the trauma field, we have much more sophisticated equipment with monitors that are able to be viewed at the nurse's station. Also, with an eye to the future, we've lead-lined the room for the installation of an X-ray machine, which should cut down the unnecessary transport of patients back and forth from X-ray to the emergency room. Also, we now have our own private elevator which can go from the emergency room directly to the operating room or the intensive care unit.
Has the new design of the emergency room benefited the services you're able to offer?
It's given us about 3 times as much space. We also have a room set aside for endoscopy. We have an observation area. We have our own cast room. As mentioned before, we still have we have the trauma room. We also have a quiet room.
Carl, it's convenient that the radiology department is located just across the hall from the emergency room.
That is convenient, and it was planned that way, and it allows for more efficient care of the patients when they come in through the emergency room, need x-rays and things of that sort. Another thing, though, that Bill Smethurst didn't mention to you was the computer technology that has been installed between the 2 departments, which allows for rapid communication between the 2 areas and has certainly cut down a great deal on the paper shuffling.
Now that we're here in the radiology department, are we going to be able to look around?
Oh, certainly, and Bill Bray is the administrative director of radiology, and he's waiting to talk with you.
Bill, what special considerations were made in the design of radiology to reflect the hospital's commitment to competent personal care?
When we started planning the X-ray department for our new expansion, we looked at many designs. We visited many other hospitals. We asked for a lot of input from our employees within the X-ray department. Our prime concern was to give privacy, so that the department was designed that as you come within the department and enter into a booth to change your clothes, you would stay within the confines of that area, and you would enter the X-ray room by a side door and would not have to be seen or walk the corridor in Johnny's.
People often equate coming in for an X-ray with or a test of any kind with a long, uncomfortable wait. Has anything been done to make that easier for people?
We are constantly striving to minimize the wait. There are many factors that preclude a speedy visit. We service patients from the emergency room who are unscheduled. We service house patients, oncology patients, and outpatients. We have in this department now a dedicated room for mammography and a dedicated room for chest radiography.
Dr. McDonald, can you describe the uses of this machine?
Yes, this is the latest in mammography equipment. It is called the Senograph. It's made in France, and it uses plain film as opposed to our previous study of breasts, which used zero mammography. And the main feature of this unit is that the dosage to the patient is really diminished by approximately 1/4 to 1/5 of what it was before.
Now, we've looked around at quite a lot of the hospital and seen various areas. Where does a patient go when they're being admitted and they're going to stay over for a few days?
Well, they go up to one of the adult medical surgical floors. Why don't we go see one now?
Could we now? Good.
Sure. Incidentally, Cynthia, this unit is known as the Reading unit to recognize the close relationship that Winchester Hospitals had with the town of Reading ever since the hospital began in 1912. And Eleanor Denault is the head nurse here, and she's waiting to speak with you now.
Good. Eleanor, your area has been extensively redesigned. In fact, you're in a whole new area of the hospital. What particular services are you able to offer in this unit?
Well, we have 10 private rooms now for patients, and all our patients, whether they're in private or semi-private rooms, have their own telephone now. We have several special rooms. One is for people that have a low resistance or have a burn. It's called a positive pressure room. We have 2 rooms that are set up exclusively for precaution patients. We have a lot of facilities for handicapped people now. The public telephone and the drinking fountain are at handicapped height. We have one private room just set up. The bathroom and the sink and the toilet are all facilities for the handicapped, so there are a lot of improvements.
How many patients do you see in a month in adult medical surgical?
Oh, about 300.
And what do you do for these patients while they're here?
Well, they're admitted the day before surgery usually. We do a nursing assessment, and that evening we do pre-op teaching and check to make sure their lab work and all their tests are within normal limits, so we can notify the doctors if they aren't. And we get them back right from the recovery room and take care of them till they're ready to go home and restore their health, do appropriate teaching, and return them to their optimum state of health.
Thank you very much, Eleanor. Eleanor mentioned that a lot of teaching goes on in her department. Does the education department help out with this, Carl?
Yes, we do. Patient education is one of the responsibilities of our department, and we work closely with the patient care staff to manage both inpatient and outpatient education programs. Cynthia, we're at the operating room right now. Dr. McCarthy is waiting to see us inside, so let's go right in.
Good. How has the space reorganization of the current renovation benefited the patients whose surgery does not require follow-up hospitalization?
It's not only a benefit to the patients, but it's a benefit to the surgeons, to the nurses, and to the many technicians that work as a team taking care of the patients. All our surgical areas, whether they be prior to surgery or after surgery, are all within the confines of one floor. We have an elaborate large receiving area. From there, the patients are removed and transferred from the outer core of our operating room suite into the operating room, and then from the operating room, after the surgery is finished, into a separate recovery area, and then into our surgical intensive care unit if the need be.
What type of features would you like to add to your surgical list in the future?
I think now that we have an up-to-date modern facility, I would love to see young, both medical doctors and surgical doctors, come to Winchester and work out of Winchester. This would ensure a continuation of high-caliber medical surgical care in the community.
Carl, conveniently, the intensive care unit is located right next door to surgery.
Yes, usually admission is restricted to the ICU, but we've got permission to go right in and look around and talk to some of the staff.
Good. The intensive care unit of a hospital may not be seen by all who enter, but for those who do need the service, the 35% larger ICU coronary care unit offers the best in 24-hour patient care. Equipped with specially trained nurses and the latest in patient monitoring equipment, Winchester Hospital's ICU is completely new. Catherine, what technical improvements have been added to the ICU?
Within the past year, we've added a completely new computerized monitoring system, which is capable of watching the patient's heart as well as pressure patterns. And it also has the capacity for being upgraded so that we will always be current in our technology.
What major changes have occurred in the ICU as a result of the renovation project?
The biggest major change has been the visibility of our patients, which was a problem in our prior setting. Now, from the expansive nurses' station, which you can see behind me, we can see the patients in the glass rooms all around from any given point.
Is this one of the design features that was incorporated to benefit ICU especially?
Yes, it was.
Are there others?
Yes, we now have a conference room where we can have conferences with the physicians. We have a physician's sleeping room where if a physician has a very acutely ill patient and wants to stay overnight, he has a place to do that. We also have a quiet room, which is a waiting area for the families of patients that are acutely ill.
Something that everyone immediately thinks of when they think ICU is the kind of loving patient care that someone would expect and hope to receive there. How does your staff accomplish this?
The staff, usually they only take care of 2 patients at a given time, and because of all the technical needs of the patients, they really could not handle more patients than that and give them the tender loving care that is also needed and the extra touches that make it more pleasant for the patient.
Thank you, Catherine. Carl, a lot of what we've been seeing has to do with adult treatment and hospitalization. Where do the children go?
In the new wing, we have a pediatric young adult unit where the children would go. The interesting feature of this unit is the swing bed concept, and this allows the beds to be best utilized either for the young kids or for the young adult, wherever the need is the greatest. It works out very well. Perhaps you'd like to see that unit after we have lunch.
I'm with Ellen Shea, the head nurse in the pediatric young adult unit. Ellen, why was this pediatric young adult unit included in the renovation to begin with?
Well, we're in a very old part of the hospital, and this gives us better visibility. And we have a young adult side that has all private rooms, and it affords them privacy, their own phone, showers. They have their own lounge now.
How do you define a young adult?
Well, they're any young person from 15 up to 21.
Are you able to offer additional services now that the unit has a broader focus?
Well, they have more specialized services for the young adults than we had before.
In pediatrics, are there new services?
It's pretty much the same as what we had on the other floor, but we have more room and a better environment up here to do it.
You're standing in front of a fancy crib there.
Yes.
What service does this provide?
Now, this is the croup room that we're in, and that's for all children with upper respiratory infections, such as pneumonia and croup and bronchitis, that sort of thing.
Thank you very much, Ellen. Carl, we could be looking at a future president here.
We certainly could, Cynthia.
I understand that Winchester Hospital is one of the major obstetrical centers in the area. How does Winchester Hospital help prospective parents?
One of the primary things that we do is offer the prepared childbirth classes frequently throughout the year. These are given by a nurse who works in the education department, who is also a certified childbirth instructor. Her name is Carol Beck. Would you like to meet her?
Yes, I would. Carol, what percentage of patients who come into labor and delivery here will have taken a prepared childbirth class?
I think probably somewhere between 80 and 90% of all the couples have at some time taken a prepared childbirth class. We have a 3-week refresher class that is within our regular 8-week class, which couples that have already had the class before can come back, learn anything new that's happened at the hospital since they had their last baby, and be refreshed on the particular breathing techniques and relaxation process so that they're prepared also.
Is your job part of the education effort that the hospital does in general?
Yes, I also am responsible for staff education here at Winchester for maternity and pediatrics. And I do some community education via the childbirth classes down at the high school. I've been at the mother-to-mother class over in Burlington that they have. So it's part of the community education also.
Thank you very much, Carol. And it would appear that there is something special attracting patients to this obstetrical center. Why is it so well known?
Well, Cindy, I think that the hospital has, over the years, maintained an excellent reputation for all services. Specific to labor and delivery, we have always and continue to be well equipped with all the modern technologies. But I think probably the most positive aspect is the warm and caring nurses that we have in labor and delivery that are really enthusiastic about caring for the family as the process of labor and delivery goes on.
Has the renovation project that the hospital is undergoing affected your unit at all?
No, no. We really have had no effect at all with the new renovations.
Mm-hmm. This modern birthing unit that we're sitting in now has the look of a new place. Is that true?
Well, it's over a year old, and we have had quite an enthusiastic response to it, and the mother and the father and the family as such that have used the room have really enjoyed it very much, and we do too. We have a number of pieces of equipment, electronic thermometer and warmers for the babies, and we have benefited a great deal from the ECHO Fund, and the members of the nursing staff, of course, belong to that fund.
Carl, what is the ECHO Fund that Ann alluded to?
ECHO stands for Employees Concern Helps Others, and it's a fund to which employees contribute. It's used to purchase patient care equipment that we could not otherwise get through the regular budget process. Respiratory therapy is one area that's benefited from the ECHO Fund, and we're here right now, so let's go in.
Good. Joe, what services are you able to offer in respiratory therapy since the renovation?
We have the capability of bringing the patient to the respiratory department to treat them as before we would treat the patient at the bedside. The services that we can offer in the respiratory department are the chest physical therapy, where we can drain the patient with a special table that we have purchased, and now we have the area to do this with where we didn't before. We also have the capability of performing bronchoscopies, which were done in the operating room solely.
What do you identify as a future goal or a need of your department?
I feel the future goal in respiratory therapy would be the pulmonary lab, which is the room we're in, and in that area, the ability to stress the patient. Right now, we perform diagnostic tests at rest. The future will be to stress the patient, such as a cardiac stress, only it will be called a pulmonary stress, and we can measure the amount of oxygen that is consumed during different levels of activity. We can then tell the patient what job or what duties they can perform in the home or at work.
Carl, respiratory therapy seemed to offer a great number of outpatient services. Are there other departments in the hospital that also offer outpatient services?
Yes, there are. One such department is physical therapy. We can go visit there now if you'd like. Barbara Reed, I think, is waiting for us.
Good. Barbara, physical therapy has now moved into its new space in the main building. How has this move affected your operation?
Oh, it's great. It's great to be back in the hospital. We haven't been here for 16, 17 years. It means that we can bring in patients down to use some of the equipment, like some of the big whirlpools or the parallel bars or some of the other electrical equipment that's never been available to them before. Staff is all in one place, so we can shuffle staff around when we need to. We can all discuss important things over lunch or whatever. Our contacts with our own staff and with physicians and nurses up on the floors are closer and more frequent.
What types of therapy do you offer here?
Well, we treat both inpatients and outpatients. We have hydrotherapy. We have 3 different size tanks for that, as well as some portable ones that we can use up on the floors. We have cervical and lumbar traction. We have inversion traction. We do quite a lot with transcutaneous electrical nerve stimulators. We have a new CPM machine, which stands for constant passive motion. In fact, we have 2 of those that the hospital's Echo Fund bought for us to use with patients who are having or have had knee or hip surgery, which is kind of an exciting thing, and we're one of not too many hospitals around that have them. We can do therapeutic ultrasound. We do a lot of different exercise techniques.
Has the renovation allowed you to implement new operations here?
We don't have any new equipment because we moved. We use the equipment that we always did have more efficiently. We've been asked to go for evening hours for outpatients. We are working on some way to do that, but we haven't implemented that yet.
Barbara, thank you very much. Carl, as we've been walking around, I've been hearing Dr. Kingsbury's name mentioned over the intercom several times. Who is he?
Dr. Kingsbury is the president of the medical and dental staff at Winchester Hospital. He's one individual you should talk to. Why don't we go see if he's in the surgeon's lounge right now?
Good. Dr. Kingsbury, how does the current staff feel about the building project?
It's a positive feeling, mixed with those difficulties that obviously occurred during the renovation phases. And those difficulties will be staying with us as we're in fact renovating the old building. But it's been an exciting time to see it develop from just a hole in the ground to something we can actually work with. And we sort of never realized how cramped we were in the operating room and in the emergency room until we began to have the more space that these areas have afforded us. It's been wonderful.
Winchester Hospital is one of many fine hospitals in the Boston area, but even with its newest additions, there must be some specialties and services that you cannot provide here. What happens when a patient arrives here whose medical requirements exceed the potential of your adequate care?
We've always been very near Boston with its many tertiary hospitals, and we've always had a relationship with these hospitals to accept this kind of patient in transfer. The patient with a major head injury, for instance, would go to either the Mass General Hospital, some of these have gone to Children's Hospital, depending on the age group, and also to Tufts New England Medical Center. We've had a relationship with them both unofficially and officially with the members of the various departments in there. These patients are given a triage here, so to speak, where they are receiving emergency care, getting started on resuscitation. We're in phone contact with the receiving hospital. Often one of our doctors and nurses will travel with the patient in that second ambulance ride from this institution in there, and they're already expecting the patient when they arrive. Sometimes we've had it such that they have known that the patient has needed to go to the operating room immediately, and that operating room in there has been ready for them on their arrival, so that there hasn't been any wasted time at the receiving institution. It's one of the nice advantages of living this close to Boston, that in fact we don't have to get over our head, and this has been something that we've been able to use a kind of good discretion with over the years. Neurosurgical patients I've alluded to, We've never tried to get involved with cardiac surgery here either. For instance, we do not do bypass procedures with a pump here, a cardiac pump here. We have always sent in major burns to Boston because they clearly need that kind of a setting. And premature infants are often transferred out of our nursery if they need the kind of advanced care that they can receive in town. And then when the dust is settled and they're feeling a little more comfortable and things are going well, they often come back to this institution.
At some point then, Winchester Hospital appeals to a certain group of people because of what it does have to offer, and that must be very adequate care in a number of areas. People will have seen that in the rest of this tape. Winchester Hospital, in its renovation, has provided many, many new services and a clean new look to the building. As president of the medical staff, have they left anything out?
Things are always happening and evolving. One of the things that was left out of the present certificate of need actually was a new CT scanner. We do have at the present time a certificate of need in for a CT scanner. That, I suppose, would be the major thing that, as we understand technology at the present time, that we do not have in-house. That hopefully will be coming soon.
Dr. Kingsbury, thank you very much for your time. Carl, this look around at the renovation project of Winchester Hospital has revealed a modern, well-equipped hospital that seems to be dedicated to the care, the health, and the well-being of the general public. Thank you very much for showing me around.
Cynthia, this has been my pleasure. We're proud of the renovation and the project. We're proud of the care that we can offer the residents of Winchester and surrounding communities. And I want to thank you for coming by so that we could show it to you.
Thank you.